So the topic and the title of this session is Life After Breast Cancer, Discovering the New Norm. So welcome to this last session. My hunch is that you've been filled with many inspiring words, new knowledge, and a sense of connection and community. There have undoubtedly been some moments today, too, that have been very poignant, that you've shed a tear, that you've felt a deep place in your heart. We end this day with a focus on what happens after you've had breast cancer and as you try to create that new equilibrium. Not only after your initial diagnosis, but throughout your entire breast cancer journey, you're trying to figure out who you are and how this diagnosis has touched every part of your being. You all know certainly about all the physical manifestations and aspects of having breast cancer. But obviously, breast cancer touches every part of your being. It is very multifaceted in its effects on us. So how does it affect your heart, your soul, your community, the people that love you? How do you bring meaning to your life in the context of the core values that you already have? Survivorship really is a fluid process that in some ways it never ends, as breast cancer will always be part of your life and part of your story. You could have been diagnosed a month ago, a dozen years ago. You may have stage 1 disease, or you may have stage 4 disease. You may be 29 or 79 or somewhere in between. You may be African American, Latina, European American, Native American, or Asian. But no matter our roots, as a survivor, as a supporter, as a healthcare professional, a breast cancer advocate, we are a community. We are one. Given that there is universality to the sisterhood of breast cancer survivorship, it is really fitting that we end our day together as a whole. Your Issues Planning Committee has been very thoughtful and has brought together, as we've all heard today, an amazing conference. They've very thoughtfully chosen speakers and topics for each session to include this panel. The collection of speakers on this panel have a vast amount of experience in working with women and men with breast cancer and the people that love them. We represent various disciplines, from a nurse navigator to a nurse practitioner in a survivorship clinic, to a physical therapist and a social worker, and a couple of us have had breast cancer. At this moment, I'm going to give each of my colleagues on the panel here a moment to introduce themselves, and they will be sharing with you what topics they're going to be covering today.
Good afternoon. My name is Juliana Paradisi, and I am an oncology nurse navigator for Legacy Health Systems here in Portland. New Year's Eve, 1998, I found a lump in my breast, and at the age of 40, I had bilateral mastectomies reconstruction. I became a grandmother this same year and underwent chemotherapy as well. So it was quite a life-changing experience on many levels, and as many of you know, your breast cancer doesn't happen in a vacuum. It happens in the midst of your regular life as you know it. My search for the new normal afterwards has led to many large decisions and changes in my life. I've discussed survivorship issues on Radio MD and Doctors Radio programs. I ended up going to art school, and I am a visual artist and a published writer, and I have shown work throughout the Pacific Northwest and published nationally. And that all came about in my search for the new normal. And I am going to be speaking primarily about relationships and managing them. I was, as I mentioned, became a grandmother, but I was a single woman at that time as well. And that's it.
I'm Kate Van Meter. I'm a nurse practitioner. I work for Kaiser Permanente.
Hang on, we're getting our technology guys catch up with our fast talking.
Go ahead. Can you hear me? Yes. Okay, I'm Kate Van Meter. I'm a nurse practitioner for Kaiser Permanente. I work in the medical oncology department. I do see women in survivorship, as well as see women who are on treatment for their breast cancer. And unlike Juliana, I do not have any personal experience with breast cancer, except for friends. I'm going to be talking today about survivorship as far as some of the mechanics of it, and then what we can look for to, what you would look for as far as reoccurrence.
Am I on? Hello. My name is Megan Cayley. I am a full-time practicing physical therapist at Providence Hospital in Milwaukee. I specialize in oncology, lymphedema, and women's health or men's health, and that also includes pelvic health. So we'll talk a little about sex. I am not a researcher, so my specialization is in practicing and in teaching. However, I do consider my practice to be evidence and clinically based. And that's it. I'm here to talk about returning to the new normal. It's one of my biggest passions in my practice is to help patients with any type of cancer, but especially breast cancer, to return to the new normal in whatever facet that comes to them at. So that's it.
So first and foremost, on April 4th of this year, I will celebrate 10 years of breast cancer survivorship. Woohoo! I have worked in healthcare for 40 years. I started when I was 12 as a clinical social worker. I mean, it's really hard for me to believe I've been a social worker for 40 years. I finished graduate school at the University of Kansas, who is currently playing a Big 12 basketball game against Iowa State, so if anyone wants to watch the score for me. And I've specialized primarily in oncology and palliative care throughout my career. I currently work on the inpatient adult palliative care team at OHSU. I've also in recent years done graduate studies in theology and spirituality and will soon become a commissioned associate in ministry at my church, Augustana Lutheran. And last but not least, I'm a proud member of the Pink Phoenix Dragon Boat team. A bunch of really dynamic, crazy, fun, and amazing women. An experience that has truly been life-changing to me. So we're going to begin focusing on some of the topics that we mentioned. What I'll be talking about actually is kind of the emotional and spiritual healing after a breast cancer diagnosis or during breast cancer diagnosis and treatment. And so we're going to begin with Kate talking to you.
In survivorship, one of the things I hear a lot is women ask me about returning to normal. And a few patients have even asked me, they said, I hate that term, return to normal, because they feel like their lives are forever changed by this experience. And I think that's true with any traumatic experience. It's never a return to normal, but instead, to me, it's more like, what can we do to help you have the very best quality of life possible? Just some of the housekeeping things that we talk about are imaging. A lot of these things come from your provider, but we believe you need imaging at least once a year after your experience. We also prefer that for the first 5 years you see a provider for a clinical breast exam and just a full exam at least every 6 months. The chief question I get, probably more than any other question, is what do I look for in recurrence? How do I know if my breast cancer has come back? So what I tell patients all the time is you look for anything that's new or worrisome that you can attribute to something else. New areas of pain, a new lump, new shortness of breath, GI symptoms, nausea, vomiting, diarrhea. I would encourage you, if you wake up one day with a new symptom, is that you at least give it some time, up to 2 weeks, to see if the symptom improves on its own or goes away. In our field of oncology, and it's in talking to all my colleagues, we all feel the same way. All things are cancer till proven otherwise. So I know when I have people come into me with a new lump or a new rash or just any new symptom, I take them all seriously until we prove that it's not cancer. And I hope you'll do the same. I think the best thing a woman can do is to become acquainted, or man, to become acquainted with their own bodies. Know what is your normal, and especially when it comes to breast tissue. To me, all breasts feel differently. So if you are good at your breast exams, and you don't have to be, good in terms of clinically, but just becoming acquainted with how they feel to you. And the same with the rest of your bodies. What's new for you? What's normal? Excuse me. I love Dr. Hassel's talk because when it comes to prevention, I thought he hit on the 3 best keys: moderate alcohol intake, daily exercise, and the thing I struggle with the most is that's maintaining a moderate weight. That's it.
All right. So I really want to talk about what you guys want to talk about. So I do want to leave some time for questions at the end. So this is going to be really pretty brief. I did make a very short handout for this closing panel. I don't know if everybody has received it, but this handout was based on the questions that we received either pre-conference or questions that the committee thought were issues that needed a little bit more attention. So that was sort of the basis of the slides. And my specialty is returning people to the new normal, which is perfect. So it's hard to return to the new normal if we're still feeling physical symptoms, okay? It's really hard. It's one of those things where whether it's shoulder dysfunction after surgery, not being able to lift up our children, or reach something high in putting the dishes away. That's a constant reminder. Returning to intimacy is a huge issue that we don't always talk about and isn't always covered. And the first question that I ever ask anyone that comes to see me, especially in terms of diagnoses like dyspareunia, pain with sex, things like that, is always, have you ever been to physical therapy before? And did you know that there was physical therapy for this? And most of the time, I get no, with sort of a little, not really sure what is gonna happen. And a lot of it is education and talking. There is treatment for all of these physical conditions. Now, whether or not that means there's complete resolution is a whole nother idea. One of the questions that the committee brought up that was a topic was the use of creams, estrogen or non-estrogen-based creams in terms of returning or helping towards painless sexual intercourse. That is a really hot-button issue. And not being a medical doctor, that is really a question for your oncologist if you happen to be going through treatment or a survivor. But I will say that there are other treatments available. Okay, there are physical therapists, there are other practitioners out there. I listed some of the things we can, physical therapy can address for that issue. I think thinking about sex over and above intercourse is a really important issue. So many physical changes, and everybody is different. I think that's a really big issue. Whether it's a scar tissue issue, that can be addressed. Whether it's a pelvic floor muscle issue, which is extremely common, that can also be addressed. So again, I want to leave time for questions in case there are some, but those were the things that got brought up to the committee. Oh, the biggest thing, and this is sort of my soapbox issue, so you'll have to forgive me. We overclean down there with our pelvic floor, okay? I know this is a breast cancer conference, and I hate to make it vaginal, but I just gotta put it out there. It's one of my first things that I talk about. It's a self-cleaning oven down there, okay? It really is. And I don't know if it's a societal issue in terms of feeling dirty down there, but I will say that for a lot of people going through breast cancer or having gone through breast cancer, even people that are living with breast cancer, that is a major issue in terms of the loss of estrogen and the loss of our personal lubrication down there. And when we scrub, we're scrubbing all that good stuff away. And that can contribute to a lot of things. I mean, not just necessarily pain with intercourse, but bladder infections and things like that that I tend to see in my practice, repetitive bladder infections for people living or surviving from breast cancer. Yeah, the rest of that is on there.
People might be uncomfortable asking you some questions, so those are some of the things you want to cover.
Oh, okay. Waxing and shaving, it's great. But, you know, within the labial folds, not so great. So again, we're sort of introducing things to tissues that may be stressed already or drier already, depending on treatment. If not, and you don't have a problem, go for it. But I think society tells us how we're supposed to look down there, and I'm not so sure that's always the healthiest for us. Positions is a huge part of returning specifically to intercourse. You know, the side lying position is usually one of the safer ones, especially for those of us that have back pain as well. That can be an issue as well. Lubrication. Okay, that is not a reflection of decreased desire. It's really important. And I mean, I just can't say enough. I would avoid store-bought products. I would avoid anything that says his and hers on it or advertises as like a nice, warmy feeling. That warmy feeling comes from things that you don't necessarily want down there, mostly alcohol and things like that they put in there to give us that nice, warmy feeling, which I will never understand. Okay, so those were kind of my thoughts as a pelvic floor practitioner, specifically with my breast cancer patients. But we also had some very specific questions about getting back to physical activity. And I think a lot of the speakers today did such a great job with that. The importance of returning to exercise, the implications on the lymphatic system, all of that kind of stuff. So I listed some of the side effects, some of the common side effects for breast cancer. And again, all of those can be addressed and should be addressed, you know, so don't necessarily feel embarrassed about bringing that up to the oncologist or your physical therapist. We had a question about immediate post-surgery limitations for physical activity. I usually say if the drains are in, I wouldn't reach above 90 degrees, really any way above the shoulder. Just let the drains and the healing process do its thing and work. If the incisions aren't necessarily healed, you don't want to put any stress on those, so that's another indication. I like to see patients pre-surgery. I was just talking to one of my colleagues at lunch. You know, that is what I am working towards, and hopefully I know a lot of my colleagues are working towards. I have worked in areas and businesses where I saw every single breast cancer patient pre-surgery. I was able to do baseline girth measurements for lymphedema and those concerned with lymphedema. I was able to go through education post-surgical, immediate post-surgical restrictions for their particular kind of surgery. And I think that's what makes it hard. I went to the reconstructive talk today, and it was amazing. But all of those different kinds of surgeries, we're not just dealing with different women, we're dealing with different surgeries, and all of those affect the body and the muscles differently. And so I think that that's a really important thing to keep in mind when we're thinking specific questions about physical activity. All the science, well, yes, all the science. Resistance training is not something to avoid, okay? We need to let the healing process begin. Obviously, I'm biased because I'm a physical therapist, but I think you should see your physical therapist to know what your particular restrictions are. I think, I don't want to get into the lymphedema thing too much, but it used to be where women were given restrictions during treatment and as they were going through treatment, and it was, you know, I'm being general, but don't lift more than 5 to 10 pounds, you know, no heavy lifting, no nothing. And that's really easy to do while you're going through surgery, right? Or going through chemotherapy or going through radiation. But then there's nothing really there in terms of what to do next. And so they used to say, don't do any of that, and that's what we're blaming lymphedema on, is heavy lifting. But the science is really pointing to the fact that it's not that it was the heavy lifting, it was the going from doing nothing to back to life, to back to real life, important things that we need to do. And so I think that my main point is it's a gradual return to activity. There's absolutely nothing, you know, Sue's doing the dragon boat. There's nothing that cannot be done physically, okay, as long as it's a slow, gradual return and it has a little bit of personalization to it. The websites obviously are sort of self-explanatory, and I will be quiet now. Thank you.
Well, after my treatment, the hair started growing back, and I started to resemble my former self. I wondered if I was ever going to have sex again in order to find out if I had dysfunction or not. It was a little troubling. It's hard enough, I think, to have relationships, and as many of us have experienced, sometimes even the basic relationships we started with flounder and struggle, even just among good friends, let alone a romantic relationship. And I know everybody here has some story of a friend that fell to the wayside or a relationship that crumbled because it wasn't able to withstand the change of what the reality of the new normal is for all of us. So I struggled along trying to figure out what I was going to do, and I moved on, and I was during the part of time when I started art school. I think it's really important to form a relationship is to get back to yourself and who you are after this major change. It's very easy that we take our breast cancer story, and I think initially for a lot of us, that's the first thing we tell people as we get comfortable with them and we get to know them a little bit, we start wanting to tell people all about it. And I think in time, and as we tell the story and we become comfortable in our own skins, that becomes less necessary. But initially, that's hard. And it works well in support groups. It works well even among women friends or same-sex friends that we have that are supportive. But I think it's tricky just to regain your sexuality in a stable relationship, let alone start over again with someone that you've never known before. So that was my predicament. And the first thing I learned was not to let my breast cancer define me. And it's a very difficult thing to do. But you are not your breast cancer. It is something that happened to you. It does not define you. It's a badge of strength. It's a badge of accomplishment, but it doesn't define you. Second point to remember, you guide the conversation when it comes to your health care. When you're meeting people, they don't know. Many of you, and I see a lot of you out there with scarves and hats, you'd be surprised how many people that are meeting you for the first time are unaware that you're bald. They're noticing the hat, they're noticing the scarf, they're noticing your face, they're not noticing the hair. People don't pay that much attention to other people. Most of us are very concerned about our own self-image and how we are coming across to the other person. So some things to just remember. You don't have to share more than you choose to. I found out also, particularly being a younger survivor at that time, that as an older survivor, if I say I'm a breast cancer survivor, I have probably 20 people in any given space would know what I'm talking about, or at least understand the implications. When you're younger, your peers may not have had any experience whatsoever with cancer or any kind of a life-threatening disease. And one of the things that came, my very first dating experience out of the box, the hair's back, I'm out and about, I'm working again, and there was a gentleman that kept coming around, and I kind of off-put him, so I'm a cancer survivor. And the first thing he said to me was, I was really sick once too. I had a heart infection and I had to be in the hospital for 6 weeks on IV antibiotics, and I thought I was going to die. And that was all that was said. He reached out to relate to me as someone else that had been sick before, and that was all he understood, and it was enough in that moment. And again, taking my own advice, I played things out, and we got to know each other slowly. And at that point where we were getting to the point where you might want to be intimate, he actually asked me, and he said, when are we going to be intimate? And I think it was probably 2 weeks into it, and I don't know what this means. I know, right? Because even for me, it was like, this is like 13, 14 days fast longer. It seemed like an ungainly amount of time before we got around to it. So in my anxiety, when he said, when are we going to get intimate? And I think it's a defense mechanism. It's really easy to get angry, right? Because it's a lot easier to get angry and push him away than it is to wait and be rejected by the wrong response. And we've all had the wrong response in various relationships. So I said, intimate. You want to get intimate? Let's get intimate. Let me tell you about intimate. I told you I'm a breast cancer survivor. That means I have had both of my breasts removed, and I have reconstructed breasts, and at this particular time and moment, I don't have nipples. They haven't been reconstructed yet. Thank you, Mary Jane Hockey. And again, waiting for the other shoe to fall, waiting to be told, oh gosh, I don't know, that's a bit much. Instead, the response was, you're the bravest thing I've ever heard of. I was thinking intimacy was sex, and I didn't realize intimacy is being able to talk to someone the way you just spoke to me. And he said, if you're up to it, I'd still like to get intimate. And so making a long story shorter, hopefully, eventually that relationship did end. It wasn't a long-lasting relationship. But the wonderful thing about it ended for all the reasons all my previous relationships had ended. You know, fear of commitment, different career goals, different lifestyles, different goals for our futures. And that was the reason why all my relationships had broken up in the past. Nothing had changed. And I will always love that relationship. I'm happily married now and have been for the last 14 years. But I will always cherish that relationship that I learned to trust a little bit, that men have the capacity to be nurturers. They have the capacity to be honest and caring, but you have to trust. So take your time, find someone. You have time to find out if this is someone you want to open up to, if you want to share it with. For some reason, he waited around 2 to 3 weeks. I don't know why, but it's amazing that somebody that actually cares about you as a human being, as a person, not as a disease, not as something to gain or something that reflects their own self-image, that you can find this. And so the first thing in that aspect is open your mind to the possibility that there is a partner out there or partners that are caring and will be there for you. Trust that there's good. I think when we have a diagnosis, we tend to think of all the things that could go wrong, and we limit ourselves by not opening our minds to what could go right. And I will also say, having now been married to a very healthy, very kind, loving, nurturing man, People that are healthy emotionally are looking for other people that are healthy emotionally, not necessarily physically, but emotionally. And so if you let go of your anger, your previous hurts, your other disappointments, and you become healthier in your mind as well as your body healing, you will attract other healthy-minded people. They're out there. But as long as our vibes are negative, I'm not acceptable, I'm not lovable, this cancer has taken over, and my body is the most important part of myself. You're sending out that vibe that someone that doesn't understand where it's coming from will interpret as anger and defensiveness. And we have to let go of that. Holding on to grudges, holding on to pain, it's like taking a poison pill and expecting the other thing to die. We have to let go of that. And that's one of the first steps. Anybody have questions about that?
We'll wait till the end for questions.
Oh.
Just go ahead and look at questions. Okay. Yeah.
In that case, I'd like to just finish up with that basically, my mom said it best, normal is a cycle on a washing machine. It doesn't exist. It doesn't exist. And so there's as many ways to navigate, to find your way as a survivor, as our individual sitting here in this room. There is no one-size-fits-all plan for how to discover your new self. But take time to get to know yourself again, get reacquainted, figure out what your goals are. Another thing on that issue, almost anybody, if you ask, can give you 10 reasons off the top of their head, 10 things that they dislike. You don't like this, you don't like that, this is unacceptable, that's a deal breaker. Most people cannot detailedly describe something they want or what it is they're looking forward to. And I would really encourage you, if you are looking for new relationships, is to take some time and visualize what are those relationships you want in your life. What do they encompass? And I'm not talking about he's tall, he's thin, he does this, or she has this skill or that. I'm talking about what are the values that make a relationship worthwhile, and to really spend some time defining those. You cannot reach a goal in your life if you don't have a clear picture in your head what it is you're moving towards. We all know what we don't like, and we run away from it quickly. But take some time. What is a good relationship for you? What does that feel like? What are the points that are important? I found by doing that, I'll back it up a little bit. I was raised in a family where I was told literally by my father, all men are jerks, from the time I was 6 years old. If you look around this room, you'll see that's not true. There's men here supporting their wives, their women, their family. And you'll find that all throughout Komen, which I find amazing. But when you're told that and you're raised that way, you have to let go of that mindset. And I started when I wasn't sure what I wanted in a relationship, and I wasn't sure what a healthy relationship looked like. I asked to be shown it. And I just said, I need to start seeing what it looks like. I'm willing to accept the fact that men aren't all jerks, that there's good men out there, but I need to see what that looks like because I've narrowed my vision so much. I only see what I want to see. I'm not seeing the big picture. And it was really amazing after the time that I asked it. I started running into really wonderful men. They were usually married to friends. They were living with friends. No, and I don't mean this in a covetous way. It was an observational way. And they weren't my partner. They weren't my perfect mate. But I started running across healthy relationships and the components that were making those relationships healthy, and starting to watch them and observe them. And that's how I started my list of what it was I wanted in my life in a healthy relationship. And You have to be open that there is just as much opportunity to things to go right as there are to be wrong, and to just be open to that.
Thank you. Sometimes emotional and spiritual healing take a back seat to our focus on the physical aspects of breast cancer. But it's really important that we honor the process as being as important as the physical healing. You know, there's really good reasons that we don't have the capacity to face all these things when we're first diagnosed or when we're facing a recurrence of our breast cancer, because as you all can remember, it's a pretty crazy making time of making a bazillion decisions, of trying to learn a foreign language in a week is what I often describe it as. You're trying to learn about all these different terms in breast cancer care. You're just trying to survive. But mind you, that doesn't mean you probably didn't have emotion, that you weren't terrified, that you weren't teary, that you weren't sad. There was certainly emotion with it, but you didn't really have the context or capacity to take a step back and really reflect and look at it. When this opportunity to pause arrives, it can sometimes be when you've finished your initial treatment and surgeries, or it could be when you've had a break in your treatment if you've had a recurrent disease. And it's sometimes a very ambivalent time. You might all recall that when you were all done that last day of radiation, the last day of chemotherapy, you're like, wow, I should be so happy, but holy crap, I'm so terrified. It's like, what do I do now? And also at that time, when you recover physically, you may be flooded with some unexpected experiences, which is dealing with the grief and loss that you've just been through over the last year. And so you now have the time to do that physical and emotional and spiritual healing, but it can be daunting. We all have, as Julie was just saying, we all have unique ways of dealing with our lives. And we all have unique styles of the way we deal with stress. Undoubtedly, all of you have faced challenges in your life before your breast cancer diagnosis. And I don't mean to diminish the impact of having breast cancer, but I'm sure that you've had some experience and you know kind of what you do when you face a crisis. But it doesn't necessarily mean it's the same. It just gives you some context. So what makes you feel whole? What is your path and what is your way? How do you define support? I bet if I asked everyone in this room, you would define it differently. Is it being with your family? Is it being with your friends, your faith community? Is it being active? Is it being quiet? Is it learning every last thing you can about breast cancer and that you know more than some biologists do about breast cancer? So I would say seek and find the support you need, whether it's through silent meditation or prayer, whether it's Tai Chi, yoga, power napping, power shopping, whether it's gathering with others that really understand you. We had a great conversation at lunch today that it's hard when you feel like you're alone, but there's an amazing amount of community in the breast cancer survivorship world that you can find other people who can say, yeah, I know what you're feeling. I know what that experience is like. I'm sure when Julie was just talking about the things she experienced as a single woman, there were probably many people going, completely understand. So find what works for you. Maybe it's an online discussion group. Maybe it is a group of women doing Bible study at your temple or at your church. Maybe it's having a cup of coffee or a glass of wine. So if you need sorting out for yourself, maybe you're not sure. There are an amazing resources in this room, many professionals as well as peer support that's available for you to help you figure that out. Whether it's your nurse navigator, your chemo nurse, your oncologist, the PA or the nurse practitioner in one of the offices, your naturopath, your PT, your chaplain. Maybe it's another woman you met in radiation therapy. Maybe it's one of your other healthcare providers. The important thing to know is that there are not right or wrong answers. This is your journey. This is your individual life. So what's right is what you think is right for you. Survivorship really is a fluid process. It doesn't just happen and you're done and you've moved on. And in reality, you're not going to be that person you were before, because how could you be? You've just had and faced a life-threatening illness. And how could that not have changed you? Doesn't mean you can't get back to being some of those things that you identify as being part of who you are and your essence. Because sometimes you might feel like that essence kind of faded away a little bit because you're exhausted from chemo or radiation or of having to contend with a recurrence. Because the core of you hasn't gone away, but it's changed. But it doesn't mean you can't match that new experience that you've had with who you are and who people know you are. But no one else can define that for you. Only you can. It's not an experience in and of itself, but really it's a slice of your life that you weave into other parts of your being. Many of you might know that the Chinese symbol for opportunity and crisis is the same symbol. So you all know a lot about the crisis of having breast cancer, whether it's you yourself who've had that diagnosis, the person you love most in the world, a colleague or a friend, or whether you are an amazing professional that helps all of us get through that breast cancer diagnosis and treatment. So there are indeed crises, but how do you deal with that crisis? How can you capture that crisis? How can you kind of rethink how the world is? Just Julie gave a beautiful example of, well, who am I? Well, you know what? It's okay if I figure out what I want as Julie, not what someone else thinks that I should want. So it's really discovering what your pearls of wisdom are, and from where do those pearls come? It might surprise you. I think someone mentioned that sometimes people that you thought were part of your life disappear, but out of the woodwork will be people you had no clue cared about you. I remember thinking when I was recovering from my breast cancer treatment, I thought, wow, I sure know how much I love everyone else, but I was quite struck by how much people loved me. Because out of the woodwork, I'm the third of 8 children. I've been a social worker for 40 years. I've been the ultimate caregiver and was raised by a woman whose name is Mrs. Do-Gooder Take Charge. So the women in my family are really lousy at taking care of themselves or allowing other people to care for us. And that's probably a common thread because we have a lot of women in this room and some pretty cool men. So receive that love, receive that help. So really, it's a time that you get to be intentional in the ways that you are living your life. You get to be clear about what's important to you and the ways that you lead your life. The real gift for me of having been an oncology social worker for years, even before my diagnosis, is that people who are facing serious illness are very clear. Whether you are a pauper or you're a millionaire, it is a universal experience that everyone has to face who they are and what they are. So really remember to listen to your body, your mind, your heart, and your soul. I'll share with you one of my favorite poems. Marianne Rodmacher is a woman who is a poet and an artist and writes some lovely quotes. And this is one called Live with Intention. Live with intention. Walk to the edge. Listen hard. Practice wellness. Play with abandon. Laugh. Choose with no regret. Appreciate your friends. Continue to learn. Do what you love. Live as if this was all there is. Live with intention. I'm going to shift gears just for a moment because we wanted to also, as a committee, talk a little bit about what palliative care is, because not everyone knows that term. Who knows what palliative care is in this room? Oh, that's actually not bad. One of the physicians I work with at OHSU says, think of the word alleviate with palliate. So palliative care really is looking at you as a whole person, but really having some special expertise. One of the reasons that a palliative care team is often called in, and it doesn't matter if you have stage 1 breast cancer or stage 4 breast cancer, is that you have symptoms that are troubling you. Pain, nausea, constipation, anxiety, fatigue. So palliative care teams usually consist of physicians, nurse practitioners, PAs that have a lot of expertise in that. It also looks at who are you as a person? What are your values, and how do you match your values with the goals of your care? How do you bridge what you believe with the healthcare decisions you're making? So often a palliative care team is called in when someone's struggling with a new diagnosis or a new phase of their diagnosis, or they're trying to make some really important decisions. Palliative care teams also are a source of incredible emotional and spiritual support. Palliative care teams always have social workers, they have chaplains, they have other people. All the palliative care providers are tremendously supportive people. And then certainly for palliative care teams, often the work we do is to help people at the end of their life. It is to provide support for families as people might transition into hospice care. And it's not just people that have cancer. Our team at OHSU and all the teams, we are blessed with many teams all throughout this community. Every health system has palliative care providers, both outpatient and inpatient, is really looking at the broad stroke. So they work concurrently. We work concurrently with all the other specialists that patients have, but is a real asset. So if any of you have other questions about that, you can ask, when we do the questions and answers, but also I'm happy to talk with any of you afterwards if you have any questions about is a palliative care provider something that would be helpful for you, either in an outpatient or inpatient setting. So if any of you have questions, if our lovely volunteers might gather them up. Why don't you all stand for a moment? If you want to, it's optional, but just to move, you're almost done. Okay. Huh. All right, the first question. We are community, aren't we? That's pretty cool. So the first question I have is, I don't want to resume intimacy too soon for fear of damaging the healing process. Are there indicators that could help me decide, okay, we're good to go? Folks, can we have your attention? Thank you. So again, I'll repeat that. I don't want to resume intimacy too soon for fear of damaging my healing process. Are there indicators that could help me decide, okay, we're good to go? And there's a smiley face. Someone's eager to go. So panel?
Yeah, absolutely there are indicators. Any type of bleeding is a complete contraindication to intercourse. Okay, so if anybody is still having bleeding, pain during the day, either with tight clothing, riding a bicycle, that type of thing is indicators that maybe the healing process isn't quite finished. Not particularly, don't know this question in terms of what tissue damage there were. If we're talking about radiation, I usually recommend that patients do see someone, a gynecologist, MD, something like that, in order to just make sure that everything is sort of healed down there. But the best indicator is give it a go. See how it goes. I mean, it's treatable. The pain with intimacy is treatable. Besides the bleeding, I can't think off the top of my head a contraindication as long as treatment is finished. Usually radiation, if we're talking about colorectal cancer, uterine cancer, or cervical cancer, during radiation, intercourse particularly is not recommended. But give it a go, and if it doesn't quite go well the first time, don't give up and don't be discouraged. See a physical therapist, and we'll try again.
When will my brain come back? Never. No. And so we can talk about that first, because there's a second part of the question. So any comments on I really believe that chemo brain is a reality, and so loss of hormonal affects brain function, but any thoughts from our survivorship nurse practitioner?
I see women, even up to 10 years out, who still feel like they're not back to normal or back to what they were pre. And so statistically, I don't know if there is a baseline that it goes back to normal. I just encourage them to be as mentally active as possible, whether that's crosswords or Sudoku or just engaging in conversation. But I don't know that it ever comes back to normal.
I always say embrace it. I claim chemo brain. It's been 17 years. I still claim chemo brain whenever something doesn't go quite the way I planned it. It's like, oh gosh. So embrace it for one thing. I was a pediatric intensive care nurse at the time that I was diagnosed and working 12-hour shifts with critically ill children. So the pressure was on coming back. I will say I did feel I was able to function again in that highly stressed industry again. But I did make certain allowances for myself. Making sure I got enough sleep at night was very important. If you all know that you fatigue easily and you're not able to multitask the way you used to, those are very frustrating things when you're highly competent at what you do. Get enough rest. I would even recommend cutting back a little bit on alcohol if you're doing shifts and stuff, maybe happy hour or whatever frequently. Things to allow your body to heal and maximize your brain a bit. Making sure you get adequate nutrition so you're not doing low blood sugar is a good idea. And even maybe cutting back a bit on caffeine. Those are things that you can do physically to maximize your health and your brain power also, so that you're not working fatigue. And you can kind of strengthen yourself that way. And it does take time. And I don't know also if it ever comes fully back, because then you hit old age, right? If you're lucky. Of course.
There was a second part to this question, which, and I actually, one thing I want to comment about, when does your brain come back? Part of your brain not coming back is also where you are emotionally. If you've not had a chance to really deal with your breast cancer and all the ways it's affected your life, it creates stress, it creates distraction. Just like many other parts of our life, it's really a grief process. And as you may have discovered, if there are other parts of your life that you've not had a chance to deal with that grief, it continues to follow you. So I would really encourage you, with some of the cognitive fogginess, it may also be how are you doing emotionally and spiritually. So remember to attend to those things. And we have a long question apparently from one of our outside.
We do. Thank you. This question is for Megan. Megan, surgeons say no restricted extremity precautions for sentinel lymph node biopsy patients, only for ALND patients. Lymphedema Society says that SN biopsy patients should practice lymphedema precautions. What do I tell my breast cancer sentinel node biopsy patients regarding restricted extremity precautions? I work as an RN in the recovery room.
That's a really good question. And unfortunately, it's patient-based. I don't like restrictions at all, unless they're specifically contraindicated. Depends on the depends on the person's level of fitness prior to surgery is a big part of it. If someone has had for instance, if someone's had a complete total shoulder and then they have a sentinel node biopsy, they're going to react completely differently and may have some different restrictions. But I agree. I tend to agree with the surgeons in terms of after a sentinel lymph node biopsy, it's pretty safe to get moving and get going quick.
I'm going to look at one of your questions, Kate.
Yes. This question is, my stage 1 breast cancer metastasized 9 years later. All the mammograms were clear, but it has now spread to my bones, lungs, and liver. How could I have discovered this earlier? Why don't we do occasional scans or other tests? I would say this is probably the second question I get is, why don't we do like annual PET scans on women who have had cancer? And it's a hard answer to answer this question. Unfortunately, when it comes to triple negative cancer, if you go to like 3 years out, it's very, very rare that cancer reoccurs. When it comes to ERPR positive cancer, HER2 positive cancer, that unfortunately, even stage 1 or stage 2 can reoccur at any time. In the old days, we used to tell women 5 years out you're good, or 10 years, and we just can't say that anymore because women are reoccurring later, much, much later than you would ever anticipate. So why don't we do something to catch it earlier? Number one, there isn't anything that's good to catch it earlier, and number two, unfortunately, it doesn't make a difference in the outcome when you catch it. I know in Survivor Clinic, I have caught just the most minute little symptoms, and it turns out to be something, unfortunately, really devastating to the patient. One was just a non-productive cough, and she just had it a few weeks, but I encouraged her to come in, and it wasn't in her lungs, unfortunately, it was in her liver. But just, it's that little thing. I truly wish we had something that we could say, okay, once a year, we're gonna do tumor markers, and that's gonna catch your cancer earlier, so when it does come back, we'll be able to treat it, but it doesn't work that way. So that's the reason we don't do that.
And dating back to having worked in oncology since the late 70s and 80s, we used to back then, the studies were different then. Women used to routinely have bone scans, chest x-rays. It was called back then a liver spleen scan. It's now a CAT scan. And lab work, and indeed it was found that even if you found you had a breast cancer, it didn't prolong survival.
Right.
The same is how people sometimes feel about doing tumor markers. My oncologist said it's up to you. But studies have shown too, even if your tumor markers are positive and you find out sooner, it doesn't change the long-term survival. What it does change is you might know sooner, which is why I opted to do tumor markers for 10 years. And so, but it's, unfortunately, we haven't figured out ways to be just 2 steps ahead of the recurrence. A question that probably any of us can answer is, how do you deal with insecurities that come with the diagnosis and after? Some things that I would say is that partly is time. I know that early on, it was usually 3 in the morning where I was just having panic attacks, and when I just found some things that I could say that helped calm me, it was really, you know, for the person that asked this question, what are things that help you deal with stress and anxiety? Not to say that other anxieties have ever been like having cancer, but what are things that have helped you in the past? Whether it's seeing a therapist and talking about it, whether it's seeing clergy, whether it's spending time with friends, what are the ways that you deal with things in your life? I think they do get better. Doesn't mean you don't always still worry about breast cancer. I know women that 30 years out, when they go have their mammogram, they get really scared, and that's 30 years out. So some of that comes with the territory, but I would say don't be scared alone. However you can face it, make sure to get help with that. And then Julia might have these insecurities in a relationship in life.
Okay. Well, I had something to speak to about the recurrence as well.
Please do.
You have to fill the negative with something positive. And we all come out scared out of our minds. And every time we get a toothache or a headache, we just know it's a brain tumor or a cough that doesn't go away immediately. Eventually, with time, you space it out a little bit more and it becomes a little easier. There's things that you can do to help reduce the anxiety. If you do go to an oncology office where they do draw labs, whether it's markers or not, make sure you communicate clearly how they will give you your lab results and how you will get the results, because if you get that phone message on a Friday evening on your voicemail saying, "Hi, this is so-and-so's office, we're calling to give you your lab work," that's going to set you off. You want to reduce those kind of issues so that you're not spending all your time panicking. So find out if they're going to just leave a message like that for you, or if you're going to get a letter. Make sure you know that when you get towards the end of your treatment, how that your office will communicate. This is a great, you can't just sit there being afraid. You need to do things proactively to help prevent it. And this is where we know that exercise is an excellent thing. Start filling up your life with non-cancer activities. Practice good nutrition. If you are overweight, this is a great time to go and be around other women that are also struggling with their weight, Weight Watchers, different kinds of programs like that, where you can get support in a non-cancer environment so you can start feeling normal again. And then also, I recommend that you stay informed. There's several very good websites that you can get information. You can always call if you've got a navigator, if you've got an oncologist to call about information. If you're afraid of something, Komen has an excellent website if you are looking for links for cancer support online and ideas of how to fight your cancer. That's Komen. And here in Oregon, Komen, Oregon.org. One of the other sites I really love, besides the American Cancer Society, which is cancer.org, is Living Beyond Breast Cancer. Really excellent site, and they actually have material for the LGBT community. I don't want to get that messed up. Survivors living with metastatic illness, and you can get a lot of information about what's going on as well, and also with exercise and nutrition information.
And they have a lot of great webinars that you can just sign up for and watch on your computer.
Exactly. As you start living beyond your breast cancer, take up a new hobby. You know, painting, learning to paint was really helpful. And I have to say, even the life drawing classes I took and sketching other women's breasts after mine were gone was a way of dealing with the grief of the loss in a way that it was private for me, but it was productive too. And I'm sorry.
That's all right. Megan had a bunch of questions, I think, that, some on intimacy and some on activity.
I have a lot of great questions up here. Kate and I got a similar question. Mine was, what should we use for lubricant? Aren't all items store-bought? Yes. Excellent point. Thank you. Although Amazon, which is my best friend when I'm at home at night without anyone around, you can get it on Amazon as well. And then the question to Kate was, what non-commercial lubricant would you recommend for one on Arimidex and
Isn't she on Fossildex?
Fossildex? Yeah.
Yeah.
And Kate wrote down Astroglide, great. I wrote down on my handouts Femglide I really like, which is usually only available online. Slippery stuff I really like. I also want, and you know, I'm sort of speaking generally, Portland. I've only been here for a couple of years, but Portland is great. They have this, I don't know if anybody's out there's been to Shebop. It is it's an amazing shop, and no, I have no connections with them at all. But it really is a great place for some of those products. They have dilators there. They have amazing salespeople there who I trust. So that would be another resource for you as well.
We have a question from Ben that I want to make sure we get to, and then we'll go back to you, Megan, for
Okay.
one more.
I will not be able to answer this question.
Okay. So can you read the question,
Yes.
please?
Please describe the new testing for triple-negative breast cancer to predict recurrence. NK View, Clear ID, and earlier than PET scan. I am not aware of these testing. So.
And then Megan, one last, we just have a few moments, so
Okay.
any questions that kind of go together, or?
Yes. How do I get insurance to pay for a pre-surgical PT visit? Ask your oncologist to send you to a physical therapist with the diagnosis of whatever your breast cancer is, okay? They have multiple diagnostic codes, ICD-10 codes. You don't have to have, it doesn't have to be a pain code. It can simply be your diagnosis, and that's our job to figure out how to get insurance to pay for it, but they will do it. The problem is that most of the time my referring physicians are radiation oncologists, so I'm not most of the time seeing my patients here in Portland until after surgery. But I think that's a great question. Thank you for asking it. If you guys know anybody who's sort of starting this process, early is better as far as physical activity goes and getting pre-girth measurements. So just don't even worry about it. Just find a PT that specializes in this, and that's our job.
And one last question.
Okay, in regards to being clean downstairs,
How
when
appropriate.
you're in menopause, there are hormone changes and chemical changes, absolutely. Do we still not scrub things down there? Actually, it's more important not to scrub things down there post-menopausal and with the hormone changes. So estrogen does a lot of great things for us. One of the things that it does downstairs is it gives us all that ooey gooey lubrication, natural stuff that some of us were so ashamed of going through puberty, and then now not so much. So absolutely, if you're drier down there due to lack of estrogen or menopause, it's even more important not to scrub. No soaps, okay? Those tissues are already predisposed to dryness and not scrubbing.
And I don't know if there's any good segue from that to the end of the conference, but if you have any ideas, let me know. But what I will say is I'm so impressed that there's still this many people in this room, because having been to many conferences, people often dash out before the last session. So thank you for staying. Just those pesky reminders, imaging technologists, sign for the session. Please, 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 please fill out your evaluation forms. You can leave the conference forms or turn them in at registration. Nursing and social worker forms, please turn them in to get your CEUs. And thank you for all of you for being here. We appreciate